Welcome to this week's episode of Surgeon Interrupted. I'm so pumped this week because we have Dr. Stephanie Pearson joining me in the studio. She is an OB-GYN and now multi-hyphenate physician who is here today to really talk about her journey through clinical medicine, her life since leaving clinical medicine, and really like this whole second act, which I think has been really iconic, certainly inspirational to me personally.
Thank you. I'm glad to be here, and I feel honored to have you interview me.
So for those who haven't yet heard about your story and where you're coming from, can you just share with us an overview of your many years in practice and then the end of your practice?
Sure, I am an OB-GYN by training and trained and worked outside of Philadelphia for my clinical career. And unfortunately, during a difficult patient delivery, my patient kicked me in the shoulder. And she just got me in the right spot. I ended up with a torn labrum. My first orthopedist really dismissed my symptoms. I ended up, over the course of 8 months, developing a frozen shoulder, met with a new orthopedist who said, "Hey, I'll operate. I'll have you back to work in 12 weeks." And we are pushing 12 and a half years now. I woke up with him sitting at the edge of my bed, telling me that it looked like a bomb went off in my shoulder and that I may not get back full use of my left arm. He was not wrong. I have considerable range of motion deficits and nerve damage in my left arm. I was not cleared to do OB or operate. Interestingly, I was cleared to do office GYN as tolerated,
Mm.
but I got terminated the day that my FMLA was up. And I had just been asked to be the chairperson of our department before I went out. And I would have been the youngest. I would have been the first female. I was their second or third producing clinician. And nobody had the decency to give me a heads up that I was getting terminated. It turns out that my contract said I needed to be able to do 100% of my job duties, and I couldn't. And so I got terminated. And then when I was actually looking for a GYN only job,
Mhm.
I found out that my orthopedist had put in black and white that I'm a liability. And so that was the end. No malpractice insurer would
Right.
touch me. At the time, it was awful. 12 years later, he probably did me a favor because knowing me and knowing my work ethic, I probably would have pushed myself and gotten in trouble. I would have either hurt myself more
Mhm.
or, God forbid, I missed something on a patient. And so it was really hard in the beginning.
I so appreciate you sharing this with us. My heart just goes out to you. I did not know that, the chair position was yours at that time. I think that that's so huge. A lot of us want to see more young female chairs in this country, and I think that to have that in sight when that is taken away with really clinical practice, I just like cannot imagine how identity shaking that would be. And also like all this work to feel like you get to a finish line chair, incredible. And then to learn that you're being like redirected off of that path. But the other thing that I want to highlight is just it's really beautiful, I think, getting to talk to people with the benefit of time and hindsight because exactly, you do know yourself. You know yourself and agreed. We've had the privilege of working together. So I know you and I totally agree. If the paperwork or like if there wasn't language that was maybe dissuading you, helping close that door, even if there were bodily cues telling you that, yeah, you're a tough cookie. You would have worked through them. I probably would have worked through, we sometimes need the universe to close doors for us
Yes.
so that we stay out of the wrong rooms.
Yes. And that's hard to see when it's happening in real time,
No, yeah,
right?
you
I
never
mean,
know in
you
real time.
can't. And, you talk about identity. I lost all of it. I did not realize at the time how much of who I was tied up into being Dr. Pearson. I kept my maiden name because it was on all of my
Mhm.
diplomas. It's how everybody knew me. And like a lot of us, after getting married and having kids and having a tough profession, you kind of lose yourself anyway. I was like, God, what did I used to do for fun? And I remember picking up my oldest son, who was 6 at the time, and somebody said, "Oh, what does your mom do?" And he said, "She used to be a doctor." And I was crushed. I mean, I literally sat down on the curb, started to cry, was embarrassed because here I am crying in front of preschool, but it was true. I mean, I had no idea who I was or what I was going to do next. I did have the wherewithal to realize that I had just turned 40. My brain still worked, but my arm didn't, right? And I've said this a million times. I don't consider myself a disabled human. I consider myself a disabled OB-GYN. And so it was really bad in the beginning. I mean, I was in daily therapy, um, medicated, and I have the most supportive kids and husband, but it got to the point where I had letters. I wrote out letters to all 3 of them, and I had a plan. And I really thought that I was better off to them financially dead than alive and disabled because, like many physicians, I learned the hard way that I'd been somewhat taken advantage of. And I was really overinsured for life insurance and underinsured for disability insurance. And I
Mhm.
couldn't get out of my own way. But clearly, I didn't do it because I'm still here. Um,
Yes, which of course, thank God. I want to kind of explore that a little bit because again, basically, I'm a physician who left clinical practice electively. I have many colleagues who've shared with me their stories where they left, whether electively or not. And I can even relate in the sense that when I wasn't a surgeon anymore, I did not know who I was. There was not like a supportive framework under that to really protect me and like help me navigate life. In my case, because I kind of saw that problem, I mean, I think I looked at it as this job is threatening my life, so I need to leave. And then I kind of saw that there was no infrastructure. So I worked for a couple years on building an identity outside of medicine, and that saved my life when I made an elective separation, essentially, like we divorced.
yeah, and I often find myself in mixed company and hearing how, so many people are burnt out and so many people want to leave medicine. Sometimes those conversations, I'll admit, are hard for me because there is a difference when you're doing
Mhm.
something by choice versus being forced to do something. And it, that took a really long time to like be okay with
Mhm.
and to realize that, I have to believe that things happen for a reason or I wouldn't still be here. And in kind of figuring out who I was and what my strengths were and what I could still give back was a process. And to your point of there not really being an infrastructure, I went and looked for one and then made it myself.
Mhm.
I am Facebook era. And I created a group called Physicians for Physicians and really just put feelers out and was and in different Facebook groups that I was in saying, hey, there's got to be other people out there who have left medicine either by choice or not,
Mhm.
but mostly disabled physicians and created a support group that wasn't there. And we have over 500 members now and it's very organic, and it's private, secret, whatever
Mhm.
those words, the
Mhm.
right words are. But it's become a really important space for physicians who have had to leave medicine, mostly due to injury or illness, where we can support each other and remind each other that we have other strengths and that we are more than our white coats. And I think that was very instrumental in helping me when I felt very alone.
Yes, absolutely. The importance of community. And I love that you created one that you certainly saw the need for yourself, but also I guess that to me, one of the questions that immediately comes to mind is I'm surprised that there's so many physicians in this community because disability in physicians is not an oft covered topic. It feels taboo in a sense. And so I just wanted to ask, number one, with the injury that you had, and I'm just going to share my thought process. I'm such like a numbers and evidence and statistics person. Sometimes when devastating things happen, I always try to turn to the numbers or the literature and I try to say, what were the chances of this happening? Did I miss a signpost? Like, of
Uh,
course, we try to intellectualize things that happen to us, like we're cut from that cloth.
yes.
And so I have no sense of like, how common is that type of delivery related injury? Is there literature on that?
No. It is almost impossible data to find because number one, a lot of doctors underplay
Mhm.
issues. They don't want it broadcast because, I talk about the tyranny of perfection that lives in medicine, right? And so we're supposed to be smarter than, stronger than, more
Mhm.
resilient than,
Right.
all of that stuff. While I'm surprised at the number, I'm sure that it's way higher than that. Um, as far as the frozen shoulder piece goes, not terribly uncommon in women, but we usually see it perimenopause or menopause, and most heal in 6 months or a year, right? I was a complete unicorn. Now, granted, it was trauma induced, and I tried to find the difference between kind of idiopathic versus
Mhm. Mhm.
trauma.
Yeah.
Um, and then you see, like, diabetics are more likely. I'm not diabetic, right? Uh, BMI, I have a normal BMI, right? So, like, I definitely felt like a unicorn and have taken some heat for it. There are people that are like, "What do you mean? People get over this. You should be better by now." Well, please talk to my body and let my body know that. We also, after the fact, um, I'd always had ideas that I was hypermobile. I was
Mhm.
very bendy. I was a ballerina. I was a gymnast, and finally met with a rheumatologist. And after speaking with her, she was like, duh, you have hypermobile EDS." And so putting that together with the injury
Yeah.
makes more sense that I've not healed the way that the average person heals.
Yeah, and I think that that makes perfect sense. I think it is a part of the healing journey to just like at least have things somewhat make sense because like you said,
Mhm.
some of the regular risk factors, no, but with your rheumatologist insight there, I can see how that like helps put the puzzle pieces together. Not only that, but especially for any of our like non-medical listeners, I guess I would just also say to your point about being a unicorn is that like the average healing journey is called average for a reason. It's not called the unanimous healing journey. It's not called the without exception. It's like that's a normal distribution. We
Yes.
talk about averages. You were an outlier in this case. You're a unicorn. Sometimes you want to be a unicorn. Sometimes you don't.
Yeah.
And this,
This one, I could have, been okay without it, but there are also times now where I wonder what would my life be like now if I hadn't left, right? I was fortunate. I didn't have to be a clinician during COVID. I didn't have to be an OB-GYN during the Roe v. Wade stuff, right? So, like, maybe I am in a better place now than if I would have stayed doing what I was doing. But that's the piece that I miss the most. I really miss using my hands.
do you do much other work with your hands now?
I cook and I type a lot, but
Oh
I
my
wouldn't
gosh, no.
really
Typing's not, yeah, we're
I
not gonna
wouldn't
put
really
that
say
under
that.
the like fun
No,
fun
I
work with your hands. Yeah, but
different. I mean, because even, like, I tried doing woodworking for a little while,
yeah.
but it was too much for my shoulders,
Mhm.
and I did end up developing a frozen right shoulder a couple years after my left, and they think it was compensatory
Yep,
and my EDS. So I now have limited range of motion in both arms, but I
I
only have
gotcha.
nerve damage in my left.
Oh, I'm sorry.
Eh,
Yeah, I can see how that would impact, like, other types of work to even, like, work with both hands or create art, like,
right.
make things at home.
And I think too, in the beginning, people thought that I was like a lady who lunched or was like taking tennis lessons or golf or something, because in the beginning, docs were like, "Oh, kick me in the shoulder. I'd love to be home." And I'm like, no, you wouldn't. It's not like I'm doing a whole lot. I am dealing with chronic pain, and no, I'm not out taking tennis lessons or playing golf. I am wallowing in self-pity in my house.
People did not say that to you.
Oh my god.
More than
All
one person said that to you?
Oh, many, many. And I still get it 12 years later. If I'm at a conference, there's always at least one person who is like, "Oh, that's awesome. Medicine's a shit show. How lucky." And I'm like, "No, no. If you're unhappy, leave."
Wow. Well, I mean, I've said this before, but I do think that doctors can be like real grade A jerks. That's to me like so unacceptable. But I do hear rhetoric like that, especially, I've heard of instances like where trainees take like mental health leave of absence, stuff like that. And, they show back up to residency and people are saying, "Oh, how was your vacation?" It's like,
Right,
come on, grow up. It's not a vacation. I'm
right.
sorry that you even continue to get those comments, but really extraordinarily inappropriate and insensitive, I think, at the time for people to be talking like that.
Yeah. I mean, I at least I'm at the point now I don't get really mad anymore. Now I'm just like, "Hey, you wanna hear my story? Because you might change your opinion."
Well, here's what I want to kind of delve into next
Yeah.
because, where you've come from and sharing that part of your story, yes, super important. But honestly, getting to the next chapter of your life, like, I think it's really important. People are going to want to know. I mean, you became essentially a successful business tycoon. I feel like I can
I don't
use
know
the
if I'd
word
call
tycoon.
myself
Yeah, I would call you like such a success story. And I
thank you.
know that I'm not in conversation with Stephanie that first year out during an identity shifting, kind of like shifting sands
Yeah,
time, and I know that we are many years out, I believe, 10 or
12.
so, 12.
Not not that I'm counting.
So we're 12 years out, but also I do think that you have had extraordinary success in the business world. And
Yes.
again, just speaking broadly to that, and it's great because I think that you are inspirational to many of us. And on the flip side, I always have to remind myself when I hear success stories, okay, I might be in my first year out of clinical medicine, and I cannot compare that no matter how much I look up to and love what somebody else is doing, trying to give even myself grace because I'm not at 12 years yet.
And it
But I do
takes
wanna be you when I grow up.
Oh, that's the sweetest. Thanks. Um, no, I mean, sometimes I think I was just in the right place at the right time. Part of it is I am type A, and in the beginning when I wanted to start the company, I busted ass, like you would expect, which I know you're doing right now, and making yourself available at all hours. But the thing that kind of pivoted for me in that thought of like, what am I going to do next? What skills do I have? And I tried a few things before I landed where I did, but I went to a conference. It's for physicians who are thinking about leaving clinical medicine and going back again. It was a hard meeting for me to be at because
Mhm,
so many of the people were there voluntarily.
mhm,
And I had to kind of separate almost my anger from that. One woman gave a talk that resonated with me. A lot of the topics, I was like, oh, this is cool. This is great. Not for me. Um, One woman started talking about how everyone has a story and everyone has information that somebody else is willing to pay for, and that you need to sit with yourself and figure out what that is. And the insurance stuff just made a lot of sense because I learned a lot the hard way
mhm.
about disability and life insurance when I got hurt. and I thought I did everything the right way, and it was literally out of sheer plain ignorance that I didn't understand, and I ended up getting screwed, and I really got to this point where I was like, maybe this is the information that I have that people need. And so I doubled down and really was like, all right, I'm as trite as this sounds, I'm going to change this industry. And I basically made that my North Star. And everything I did for a long time was about building that space. And I would lecture to area residency programs more about just my story and not to make the mistakes that I made. And I would send them to my partner, Scott. And then about a year and a half into me doing that, I
Mhm.
was like, wait a minute, why am I just a commercial? And so my husband was like, go get licensed and let's see where we can take this. And so I locked myself in my room with books and colored pens and pencils because I'm a dork and took the test and then cried in my car. And I called my husband Ryan and I was like, okay. And he's like, why are you crying? I'm like, I didn't get an A. And he just laughed at me. He was like, Steph, did anyone ever ask you your board scores? And I'm like, no. He's like, do you really think anyone's going to ask you what you got on your insurance test that, oh, by the way, you studied for less than 6 weeks for? And I was like, I guess not. Just going to show that like we can take the girl out of medicine, but you can't really take medicine out of the girl. Um,
A
you
lot
know,
to unlearn as we assimilate into society. I totally agree. Yeah, it's a different yardstick.
yeah,
And so you just had those weeks to prepare
yeah,
and then you were on board. I mean, I've shared
mm,
this before, but I did sign with you and your company as a
really.
PGY4. It was literally that a female co-resident said, "Hey, I heard Stephanie on a podcast. I liked this person. I liked what she was saying on there. I didn't even hear the podcast. I don't need to hear it. I just a woman who I respected and trusted said that to me. She was like, "Yeah, I liked her. I signed with her. I know you were saying that it's on your checklist for the year, so you might want to check them out." And, having met you that way and worked with you, I do think that there's really something about like being an MD. And yes, you lived that experience and you talk about your own story, but you also have the background of being an OB-GYN and being an MD. And I felt like that meant a lot to me and just made me comfortable in an industry where I also had no idea what was going on and like
Yeah.
really didn't want to learn either. I was like, I have negative interest in insurance, like, and I'm very busy. So
As did I when it all
yeah,
started, and
yeah.
part of our mission has been to like remind people that there is education behind this and it's not a one size fits all and it takes a little bit of time, right? I mean, I remember how hard it was to schedule anything. And so I'm regularly impressed with how people can actually speak to me during the day sometimes. Um, but I think some of the more important pieces of me being a physician is in the advocacy space because if I don't know it, I know how to find it, right? And so I can look at somebody's medical history, surgical history, medication list, and help set realistic expectations, which I think is huge in, walking in somewhat blind, having all of this information shared with you, but more importantly, to be like, okay, look, this is what I really do expect to
Hmm.
happen and we want to make sure we're on the same page. And I think that that was part of what catapulted our company. It did grow faster than I thought it would. And I think a lot of that has to do with the trust in the fact that, yes, I've lived the life that you're all living, and I understand medicine in a way that I can truly advocate for people. There is a very big difference between community medicine and insurance medicine, but then I can also explain that to
Yep.
physicians in a way that makes sense,
Yeah.
right? And so I think that's really kind of where like where we shine, um,
No, I love that.
and in service, right?
Yeah. I think that for me too, I feel like I'm allowed to say this. This is just my personal opinion, but like being a female physician is like a specific club.
Yeah.
I mean, if I'm looking at an industry that I don't know anything about, and let's say that it's run primarily by like older men, I do think that it stands out and it meant a lot to me. And I know a lot of my contemporaries just in terms of like, okay, getting to work with a female MD carries weight.
Yeah, I hope so. I mean, I'm trying to live up to the expectation and experience. And, I really want to continue to lead a life of service. I mean,
Yeah.
that's why I went into medicine. It's why I'm doing what I do now.
I think it's such a through line, but I also even wanna call back to one of your points, which is that, like, to an extent, surgeons are you put them in any context, and, like, there are some idiosyncrasies about surgeons, including that we'll just, like, work until we drop and,
Mhm.
have, like, maybe more exacting standards than most in the real world do and things
Mhm.
like that, but I appreciate it even while I'm trying to unlearn some of it myself, and I know that I mean, at what point for how long were you still working Saturdays?
I still work Sundays. I gave
Okay,
up
so
I gave up Saturdays for a while, and then it was either last year or this year that I was asking our producers
mhm.
to cover nights and weekends, and I won't ask them to do something that I won't do myself. So I actually work Tuesday nights and I work Sunday mornings. Maybe in 2026 I'll pull back. I just turned 52 this week, and I think I have put my time in.
Happy birthday.
Thank you.
Yes. I love that. No, I love your work ethic. Again, I really admire it, but I also think that that speaks to an important quality in leaders. I certainly agree with you. Leaders who act like, okay, I'm far above this task, only a peon would do this task. I think that that creates problematic kind of hierarchies and expectations in the workplace. So,
Yeah.
just kudos.
Yep.
I before we wrap up, I want to touch on one final topic that I think is so, so important. And I will share, like, for me personally, as I did that work of decoupling from my profession, just
Yeah.
figuring out how to grow up and be a person totally independent from being a surgeon, one area that I had so much sadness and regret over was just not nurturing my female friendships in my life with
Ugh.
the care and, like, love that I would give them if I could go back, but also I can control time from, now forward, and so I do put, like, a lot of more emphasis and attention on them now, and I think that that's something that like, I don't think I'm alone in that, like, being a physician is so all-consuming, and I don't think it's uncommon that you get to the end of the road, you're like an attending, and it's kind of like, well, I've been hiding under a rock for all these years.
I think and I may be wrong here, but I think it's even more drastic on an L&D floor where most of the nurses are also women. And quite honestly, I thought they were all my friends. We would do events together, we'd go to dinner together.
Mhm.
I got hurt, I left, and all but two of them disappeared, and I had that same realization of, oh my gosh, do I have girlfriends outside of the hospital? And luckily enough, at the time, our kids were 4 and 6. So they were
Mhm.
in preschool, and I got to do the preschool mommy meet thing. And three of those women are still three of my best friends. And it was a stark silo of me getting hurt, of being like, oh, okay, well, now I can make some friends and try to what's the word I'm looking for? Reignite some of my
Mhm.
college friendships.
Mhm.
And even now, it's still hard. I mean, I think it's really hard to have friends when you're married and have kids and have animals and have a job. I'm done during the week. By the time I leave the office, I get home, Ryan and I cook dinner, have dinner with our son who's home. I'm ready to like decompress for like maybe an hour. I go to
Mhm.
bed at like 8:30. So, the whole like,
Ditto.
hey,
I love
let's
that.
meet up for drinks after work or let's go to dinner during the week. I'm like, I just don't have the stamina anymore. So it's more Saturday mornings. I try to keep open to have coffee with a friend. Sunday mornings, I actually have 2 really good friends, and we try to start our week every Sunday by meeting for coffee in the morning. But it's still hard. I mean, I it will get a little bit easier, but don't kid yourself. It's just really hard having friends as adults.
Yeah, for sure. I am making a real effort to like just carve out more space for it.
No, I agree. And you have to, I mean, the one thing I say is you have to put it on the calendar. I have found that, like, if it's not on the calendar, it doesn't happen. Like, you can say, "Hey, let's make plans. Let's make plans." And then 2 months later, you're like, "We never made plans."
Yeah,
And so I do try, and again, I'm not perfect, but I do try when, like, people start talking about, "Okay, let's make plans," of being like, "Okay, we have to put it on the calendar, like, now."
for sure. My newest thing is I am scheduling phone calls, and that's going very well. But I mean, literally, that has to go in the Google Cal now.
Yeah,
And
I
it's
do
just
that. I do that. And, like, you know, I have a couple of friends who have their own businesses and have their own calendar links, and we'll send each other our calendar links, and I'll accept the fact that, you know what, on whatever, like, say, on Thursday, yeah, I blocked an hour out to talk to 2 of my friends. I'm not gonna be working on business. Like, I deserve that, right?
yes.
And we have to remind ourselves that we deserve it. And, at the end of days, you know, I don't care what you read about near death experiences or end of life stuff. Nobody says they wish they worked more. Nobody. And that's something that I've really only tried, like, hard for the last maybe 2 years to
Mhm,
remind
mhm.
myself, because there are days where I'm like, I should really do this. Or, I had to get over the no emails in my inbox because I was up until, 2 or 3 in the morning, and realizing that, like, nobody's in an emergency. And if I'm a day or 2 behind in my inbox, so be it. But, like, that was really hard to get rid of that mindset that we had as physicians of, I can't leave until all my charts are done. And, oh, someone else needs a case. Sure, I'll do it. Right. Like that. Yes
Exactly. Well,
mentality.
and just even like the communication style, which is that
Right.
if I get paged, I have to respond to that page like post haste. I mean,
Mm-hmm.
immediately. And so I love that you bring this up. I have been talking about inbox zero every day this week. And because this is very much something I am grappling with, and I have to relate differently to these messages. I
Yes.
used to brag, our pathologist at the hospital, he paged me with a path result, some, diagnosis, and I would call back so quickly that he would answer laughing. He'd be like, "Okay, you're always the fastest callback
Yeah.
doctor." And I was like, "Yeah, yeah, I am," because
Yep.
I take it very seriously. I always had my pager within one arm's length distance.
Yep.
Like I didn't even lollygag about it. And so if you texted me or called me, I mean, I was 100% answering it. Just since I've transitioned to a different career, I'm the reason that I carried all those habits over.
Yes.
Like, and also I work for myself, so I
Right.
can't say that the boss is a
Right.
jerk anymore. I can't be
Right.
like, the boss is running me into the ground, although she is at times. And that's been
Yes.
like very revealing to work through that.
Yeah. I mean, I was the same way, and it took me a really long time. And then I have to remind myself, like, all right, how long does it take a patient to come see you? Weeks, if not months. So if it takes me 24 hours or 48 hours to get back to you, like, it's a win,
Absolutely.
you know?
Okay. Well,
Yes.
I love it so much. Thank you for sharing a lot of wisdom here with us today. I
My
think
pleasure.
a lot of interesting insight. Do you have any final words of wisdom that you'd like to leave us with?
Everyone needs disability insurance before they graduate. And I think for some of the younger listeners, because I'm on the other end, I think that making sure while you're in training that you are holding on to some hobbies and things that make you you is so important.
Very beautifully said.
Of you. Thanks.
Well, thank you so much. We'll have to have you back another time because I feel
My
like
pleasure.
there is a lot for us yet to unpack.
Well, thank you for having me, and I'll come back anytime. Take
Amazing.
care.
Thanks for listening to this week's episode of Surgeon Interrupted. If you enjoyed the episode, please rate, subscribe, and leave us a review. Until next week, remember, if anyone is going to suddenly appear and change your life, That person is always going to be you.